Have you ever considered orthodontic braces or clear aligners as an adult? Well, if you have, this is the video for you. Today, we're going to discuss a few things that make a really good reason to go into orthodontic treatment as an adult, and we'll also discuss a few things that are very unique to our adult patients that we generally don't see in our adolescent patients. So don't go anywhere. We're going to jump right into it. Hey, my name is Dr. Jesse McGuire. I'm the owner and orthodontist at ProSmiles Orthodontics in Goodyear, Arizona. Our goal with these videos is to educate, motivate, and initiate your journey to your best smile. We serve patients of all ages from 7 to 77. We proudly serve the residents of Goodyear, Avondale, Litchfield Park, Surprise, and even Buckeye. Today, what we're going to talk about, pretty simple, adults in braces. Adult braces is a really big growing demographic in orthodontics, and adults are actually coming to ortho offices in record numbers. And if you don't believe me, check out your Facebook feeds, your Instagram pictures, your Snapchat stories, and check out your adult friends. Some of them in there have braces, either clear braces or clear aligners. Having a great smile and a great bite really makes us feel young and very youthful. And so adult patients, we're living longer. We want to live life to the fullest and live life better. And so patients are going back into ortho treatment maybe for the second or third time, or getting braces for the first time so they can really have a really beautiful smile and a really good bite and live life to the fullest for the rest of their years. So adult patients tend to come into the office and they have different needs than our typical patients, our younger patients. The very, very first thing is adult patients want an aesthetic option. So they are really looking at either a clear bracket or a clear aligner. And check this out. So I actually have a clear aligner in right now. It's not affecting my speech. You can barely see it. You probably didn't even notice that I had it in, and here it is. I'm gonna set that to the side. So adult patients desire an aesthetic option. They also desire an efficiency and a speed in their treatment. They wanna get into braces and they wanna get out of braces. They require or request a lot of convenience with their timing and scheduling of their appointments. So they need an office that's really flexible, maybe that offers early or late hours, and also an office where they have excellent communication with the doctor. And so because these are just really unique needs for adult patients, I thought a video today would be really good to jump into that and discuss a few things for adult patients. So here's 4 reasons to go into orthodontic treatment as an adult. The very, very first one is really important. It's something I really care for dearly. Get patients back into the dental offices if they need it. And so I kind of talked about this in our last video. If you want to go back and look, it was about what happens at your initial consultation. But getting patients back into the dental office is a really, really great benefit of orthodontics. So if you haven't been to the dentist in a while, you haven't seen a dentist in 6 years, you have cavities, you have bone loss, you need root canals, or you have wisdom teeth, maybe you need extractions. It's okay, come as you are. We really want you to come into the ortho office, and that gives us a chance to send you out to other offices that you might still need to go to. So we don't want you to feel like you can't come to the ortho office just because you haven't been to the general dentist in a long time. Ortho is very stress-free or stress-less, or there's less anxiety sitting in these orthodontic chairs compared to just a regular dental chair. And a lot of times, the only thing that brings a person into a regular dental office is pain. So having you in the chair, being able to discuss your dental history and refer you out to an endodontist for a root canal or to an oral surgeon to get those wisdom teeth taken out, it's something that we really take pride in. We want you to have really, really great oral health before you start braces, or get you to really great oral health with braces and general dentistry kind of matched together. So that's really one of the big reasons to go into orthodontic treatment. We're kind of using braces as leverage to get you back to great oral health, as a motivator to get you back to great oral health. The second reason is to improve your overall smile aesthetics. So the most obvious component of the smile is having nice, straight, aligned teeth. And that's probably the one benefit of braces that everybody knows. But there's other components that make up a really, really great smile. So the first one is definitely having nice, straight, aligned teeth. The second part of a great smile is what we as orthodontists call the smile arc. The smile arc is a hypothetical curve that runs along the edges of your upper front teeth, kind of like this. When you're young and you're youthful and you have a very youthful smile, that curve follows along with the curvature of your lower lip. So as we age, we tend to lose that curvature, whether it be through natural attrition of the teeth or changes in your lips or soft tissue profile. When we lose that curvature, the smile arc, you're aged by that smile. So one of the other reasons to go back into ortho or go into ortho treatment as an adult is really to improve or regain that smile arc. The third component of a really great smile is your midline. So if you put a dot here and a dot here, drew a line down the middle of your face, that's your facial midline. We always want your dental midline to match with your facial midline. There's a really, really important reason for this. The human eye and the mind, they're an amazing team. When we see symmetry or when we see balance with anything, we notice it in the back of our minds, but it doesn't catch our eye. But what does catch our eye is when there's an imbalance or where there isn't harmony. And so when your dental midline, particularly the upper, is off from your facial midline, it really draws people's focus away from, like during a conversation, it draws their focus away from your eyes, which should be the focus of your interaction. If you need to gain that back, that dental midline, to get those coincident with your face, that's another great reason to go into orthodontic treatment. Sometimes dental midlines are off because you're really crowded or you had some teeth collapse into a space and everything kind of shifted over. So getting that dental midline back to where it should be is really, really important to recreate that harmony and that balance in your smile and your face. The last part to a really, really great smile is your gingival architecture or your gum tissue and how your gum tissue looks with everything else. So you can have really, really straight teeth, you can have an awesome midline, and you can have a beautiful smile arc. But if your gum tissue is receding and you're showing a lot of root structure, if your gum tissue is really inflamed or really thick and puffy, maybe from some medications that you're taking as an adult, those things can really damage the overall aesthetics of what should be a beautiful smile. So getting into ortho, getting your teeth aligned, and then possibly at the end having like a laser recontouring can really perfect and make that smile absolutely beautiful. So those four things kind of make up a really, really great smile. The third big reason to go into orthodontic treatment is to make it easier to keep your teeth clean and to access those hard to reach areas. So when your teeth are really crowded or crooked, it's just hard to get into certain areas to keep everything clean. And so getting braces or clear aligners and straightening everything out will really give you much better access. So your toothbrush and your floss can access the areas and mechanically remove the plaque and bacteria that's kind of sitting in those areas. So imagine that your teeth are kind of like, it's like books on a bookshelf. And when those books are nice and aligned and in a row, it's easy to dust and get everything nice and clean. But when those books are tilted and turned and there's crevices and cracks, it's just hard to get in there and get everything clean. It's not impossible, but it's really difficult. So getting everything nice and straight allows you the access to keep your teeth clean. And access is one really big requirement to just keeping everything clean. So that would be the third reason to go into orthodontic treatment as an adult. And then the fourth and final reason, and this one's sometimes overlooked, but it's to improve your overall digestive process by improving your chewing. And so chewing is actually the first step in digestion, and it kind of gets overlooked. We always think of digestion happening inside in the stomach or in the intestines. But actually the first step is really chewing your food well and properly. And so if your teeth aren't aligned and your bite's not very good, it's really hard to chew and mechanically break that food up into smaller particles from the big portions that you put in your mouth. So when you do break that food up into smaller particles, there are enzymes in your saliva, and that saliva covers all of the areas of the particles, and that actually starts digestion here before it gets down here. That really takes the workload off of your stomach and your intestines to finish the digestive process. So if you experience digestive problems like bloating or gas or diarrhea or constipation, this may be relieved somewhat by simply improving your ability to chew and you taking the time chewing your food properly. It really could be helped by that instead of just getting it in there and swallowing and not really properly getting the digestive process started. So you want to take some of the workload off of the stomach and the intestines by actually chewing your food efficiently when you put it in your mouth. And braces can help you do that obviously by correcting your bite and getting your teeth nice and straight. So those are really 4 really great reasons to go into treatment as an adult patient. Now, here are a few things that are very, very unique to our adult patients, things that we typically don't see in our younger or our adolescent patients. And this is basically because adults come into the office with pre-existing conditions. And we kind of touched this before, but they come into the office with pre-existing conditions. Bone loss or missing teeth or TMJ or other dental needs. And so here's 3 things. The first one is periodontal disease or periodontitis. And this one's very, very serious. So periodontal disease is a chronic inflammatory disease that's caused by a combination of bacteria hiding out in deep pockets that you can't clean, and your body's immune response to that irritant. And it's a devastating disease. And I truly cannot emphasize that word enough. It is absolutely devastating. It causes bone loss, it destroys bone tissue, it destroys gum tissue, and it really is a devastating, debilitating disease. And so that is one thing that patients will come into the office with. Now, the bad news about periodontal disease is it can't be cured. But the great news about periodontal disease is that it can be arrested or controlled or stabilized. And that is something that happens between your at-home care, and you have to have the care of a dental professional to also help you with that. So the great thing is we can still treat you even with periodontal disease, but it has to be controlled. And that is a big key. So we want to get you into those offices that can help you control that disease process. Periodontal disease isn't talked about very much, but if you think of the other chronic inflammatory diseases that you hear a lot about, it falls into that same category. So osteoarthritis, rheumatoid arthritis, lupus, inflammatory bowel disease, or Crohn's disease even. So these are diseases that we hear all about. We hear, stuff on TV and on the news and in different feeds and different posts, but we really don't hear about periodontal disease, and arguably it's the most destructive out of all of those possibly. So very, very important, and one thing that we always watch out for with our adult patients. The second thing that adult patients tend to present with is missing teeth and a collapsed bite. And so life happens, right? And so maybe when you were younger, you had a cavity and your parents couldn't afford to have it taken care of, so they had the tooth taken out. Or maybe when you were a young adult, you didn't have the financial means to save a tooth with a root canal and a crown, so you opted to have the tooth taken out. And here we are, fast forward, 12, 15 years, and now what you're seeing is your teeth are either tipping into those spaces or your entire dental arch has collapsed into that space. Big, big problem. Obviously, it affects your chewing, your ability to chew. It can cause some TMJ or TMD problems because your bite is off. And also, it just doesn't look very aesthetically pleasing when your teeth are tipped in. When you smile, you have big buccal corridors or these dark spaces on the side of your cheeks. So instead of having, a really nice, bright smile where your teeth fill up the frame, right? You have these buccal corridors, these dark corridors that don't look very aesthetic. So sometimes we put braces on in adults and we open spaces back up to try to regain some of that lost or take away some of that buccal corridor that you see and definitely regain some of the collapse that's happened in the dental arches. The third thing that we see that's really prominent with adults, or that we usually only see with adults, is TMJ, or temporal mandibular joint dysfunction. So what is commonly known as TMJ is actually TMD. The D is for disorder. And so we tend to see that in our adult patients. Sometimes they come in and it's an undiagnosed TMD, where no one's ever told them and it's never been diagnosed or treated. Sometimes patients have been diagnosed and they know about it, and once they get braces on, it kind of flares back up. And so another positive is we can still treat patients that have had signs and symptoms of TMD. The mild or moderate cases of TMD, where your signs and symptoms such as popping or clicking of the jaw joints, pain, maybe muscle tenderness in your upper back, neck, temporalis areas, maybe you have tension headaches. If those symptoms are mild or moderate in nature, we usually can address those pretty conservatively. So we are going to put you on a regimen of like ibuprofen or non-steroidal anti-inflammatory drugs to break the pain cycle. We also use a lot of moist heat in those situations to calm those muscles and to make sure that they're not spasming, causing clenching or grinding. We also know that TMD is exacerbated, or it's made worse when we have low quality of sleep. So sometimes we'll recommend or we'll prescribe a muscle relaxer so you can have a really good night's rest and get a good quality of sleep, as opposed to just sleeping for 18 hours, right? We want to have a really great quality of sleep during your sleep time. So that's what we do when the symptoms are mild or moderate. In the unfortunate cases where we have severe symptoms of TMD, severe pain, jaw lock, open or closed locks, there's two types. When we have those severe symptoms, sometimes we actually will discontinue orthodontic treatment and we'll just take the braces off. Those are really three things that we see with adult patients that we just don't typically see with our adolescent patients. So, to all my adults out there, now you are ready to get started with ortho treatment, and you know 4 reasons why, and you know three things that we look for or that we notice with our adult patient. Thank you again for joining us. Join us here next time, same channel, 7 p.m. next Sunday with another great topic and another question and answer session. We look forward to presenting a great topic to you. So that'll be our 4th one. And we're really excited to do this for you. So the question of the day: who do you know out there that could benefit from adult braces, and why? So tag that person, let them know that you're thinking about them and that they are on your mind. From ProSmiles Orthodontics, I'm Dr. Jesse McGuire. Thank you for joining us. We'll see you next Sunday. Super excited to have you guys in the office. Take care.